As a healthcare provider, you're no stranger to the challenges of prior authorizations, especially for high-cost medications like Xtandi or enzalutamide. This life-changing treatment for advanced prostate cancer requires a detailed and often time-consuming approval process, one that demands accurate documentation, precise coding, and effective communication with insurance providers. In this video, we'll walk you through practical steps to streamline the prior authorization process for Xtandi. By the end, you'll have actionable insights to spend less time on administrative hurdles and more time delivering exceptional patient care. Let's start with a key point: understanding the policies of the insurance company you're dealing with. Insurers set different requirements depending on the patient's plan, be it commercial insurance, Medicare, or Medicaid, and they use these rules to ensure medications like Xtandi are prescribed appropriately. To avoid delays, always check the patient's plan formulary to confirm coverage, see if step therapy is required, and familiarize yourself with the submission guidelines and timelines specific to that insurer. Why is prior authorization so critical for Xtandi? Simply put, it's because of the medication's high cost and its use in advanced prostate cancer cases, such as metastatic or castration-resistant forms of the disease. Insurance providers want to ensure that Xtandi is medically necessary and aligns with their evidence-based guidelines. This process, while tedious, ensures the right patients receive the care they need. Now, let's break this process into 6 actionable steps. First, begin with a detailed patient consultation. Your documentation should thoroughly support the need for Xtandi, including the patient's diagnosis with ICD-10 codes, diagnostic test results, and records of previous treatments. For example, you'll want to note resistance to hormone therapy or any other failed treatments to clearly show why Xtandi is the next logical step. Next, complete and submit the prior authorization form. This step requires absolute accuracy, no gaps or missing details. Be sure to include the patient's demographics, insurance information, and a clear justification for why Xtandi is medically necessary. Since each insurance company has its own forms and submission protocols, double-check that you're following their specific guidelines. Step 3 involves submitting comprehensive supporting documentation. Include lab results, imaging reports, and prior treatment records to build a strong case. For prostate cancer, this might include PSA levels, biopsy findings, or scans showing disease progression. Make sure all coding is correct. For example, use ICD-10 codes like C61 for prostate cancer and 𝗫𝗁𝗱𝗏46 for a personal history of the disease. Errors in coding are one of the most common reasons for delays or outright denials. After submission, don't just sit back, follow up. Confirm that the insurance provider received your request and ask for a timeline on their decision. Routine cases can take anywhere from 2 to 14 business days, while expedited cases might be resolved within 72 hours if there's an urgent medical need. If the insurer requests additional information, respond quickly to avoid further delays. Common requests include more detailed lab results or stronger justifications for medical necessity. Assigning someone on your team to track these follow-ups can make a huge difference in keeping things on track. Now, if your request is denied, don't lose hope. Start by reviewing the denial letter to understand why the authorization was denied. You can often strengthen your case by submitting updated documentation or a detailed narrative from the prescribing physician. If necessary, file an appeal and ensure it includes all the required materials. For urgent cases, request an expedited appeal to prevent delays in treatment. The prior authorization process for Xtandi might feel overwhelming, but with the right approach, it's manageable. Thorough documentation, accurate coding, and proactive follow-ups are your keys to success. And for busy practices, outsourcing this process can free up significant time while ensuring your patient's needs are met. For practices looking for tailored support, Staffingly offers professional healthcare outsourcing services to handle prior authorizations, appeals, and more. It's a solution designed to give you back time and focus where it matters most, on patient care. If this sounds like something your practice could benefit from, visit staffingly.com or contact them at 800-489-5877.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.